Welcome to my channel. This is Natalie Catherine. I'm Natalie Pepito, and I have been a daycare owner and provider here in Park City, Utah since 2002. So today, I would love to talk about biters. And when I talk about biters, I'm specifically talking about babies and toddlers. So we're talking about 9 months to up to 2 years old as far as biting goes. Those are the kids that I mainly deal with. Biting is very normal in babies and toddlers. I'm going to stop saying babies because it's mostly when they're about a year old, from a year on up, and when they get teeth, pretty much, yeah? So I'm going to be talking about babies and toddlers that bite in a daycare environment or even at home. So this video is for both daycare providers and for parents that have a little biter in the midst in their household. Is biting normal? Yes. Biting is very normal when it comes to babies and toddlers. They learn so many things through tasting things with their mouth. So you'll notice that babies put all sorts of toys and objects in their mouth. That's a part of their learning development in their brain. They put things in their mouth. When they start to teeth, they start to gnaw on their fingers. They start to gnaw on toys. So this is why there's teething rings. That's why there's frozen toys. That's why we have different toys for different phases of babies teething, correct? Well, just because they finish teething doesn't mean that they still have that mouth sensory fascination that they have within themselves. And every child is different. Every baby is different. So this is not a blanket statement for all babies and toddlers, which I'll explain in this video later, which, by the way, my daycare here in Park City is called Heaven's Little Angels. And visit my channel, this channel, like and subscribe to my channel if you like the content, and also comment down below if you want to hear other topics that I can discuss. So I've got my show notes here. All right, we're going to deal with a biting toddler. How do we deal with a biting toddler? Whew, that's a hard one, especially if you're a daycare provider and a parent, because when you get that phone call that your toddler bit someone and they left a mark or they broke the skin, as a parent, you freak out because you're like, oh, why is my kid acting like this? And then as a daycare provider, we're thinking like, oh my gosh, the parent's gonna be so mad. So both of us are thinking the same thing, but the parent thinks, oh, the daycare provider is going to think I'm a bad parent because my kid's biting. What am I doing wrong? And then the daycare provider is going to be thinking, oh my gosh, the parent's going to think that I'm a crappy daycare provider because I'm not supervising the children properly because his kid bit. Not the case, people. It is normal. This is a normal development of a baby/toddler. Some babies don't bite. Some toddlers don't bite. In fact, a lot of them don't. But if they do, it's normal. It really is. Now, the key is to figure out what kind of biter you have in the midst and what you can do to redirect them until that phase is over with. Now, a disclaimer, I'm not a psychologist. I'm not a psychiatrist. I'm not a doctor. I am a daycare provider owner who has been in the trenches for 20 years watching and observing babies and but dealing with those behaviors over the years. So I've seen my fair share of biters and dealing with parents and parents dealing with me. So I feel like I can offer a little bit of insight. What I've found is there's 3 types of biters for the most part from what I have seen, okay? First one, number 1. The happy biter. What is that, you ask? Okay. The happy biter is that happy-go-lucky toddler who's got a sparkling personality, and they just get so excited if they see their friend that they just like go to them and they like headbutt them. Well, not headbutting them like this, but like, ooh, I'm so excited to see you. And then I bite you. Oh, I'm so happy. That's a happy biter. I had one in my midst, and this kid is so cute and so adorable, but I have figured this baby out because I know that this baby gets so excited to see his friends and that he goes after them, and it's not younger friends, it's older friends. And he goes and he kind of like pushes his head against the child, and then he went in for the bite. And that was the first time I saw it, and I'm like, uh-oh, gotta watch this kid, right? I will tell you how to deal with the happy biter in a minute. The second biter is the impulsive biter. Now this child, if he or she gets mad or gets frustrated in any way, or they get excited, it's just kind of a combination. They just bite, right? It could be a caregiver, it could be the parent, it could be a sibling, it could be another child, but they act before they think. And that's my impulsive biter. They act before they think. And then once they realize they did it, they're like, oh, you can see their little wheels turning, like, oh shit, I shouldn't have done that. And they have the ability to think that, but not in those exact adult terms. But you can tell that they're like, oh, what'd I just do? That's my impulsive biter. And then the third biter, which is kind of harder to deal with, is the frustrated biter. This biter gets upset because they can't communicate. They want to communicate so badly with their caregiver, parent, or the child that they're playing with or hanging out with, that they want to talk. They want to tell them, no, I don't want you to do that. Don't take my toy. Or daycare provider, have him stop bothering me. And they get frustrated, but they can't verbalize it, so they take matters into their own hands, and they're gonna bite that kid. That'll show them. That's my frustrated biter. And it's really hard to catch them sometimes because depending on their age, sometimes they know they're not supposed to bite, but they do it on the down low and they sneak and they do it. Yeah, those are the biters that you have to be really careful for. And those are the biters that you discuss with the parent a plan of action sometimes as well. It just depends on how often they try to do it, how often it happens. On the bright side is I can count on one hand the amount of severe biters that I've had in my 20 years. So relax. It's not that bad, people. We'll get through it together if you have a biter. So now we're going to talk about what you can do at home or what you can do as a daycare provider in your center if you have one of these three types of biters. I'm going to turn my page. If you have a happy biter, basically what you're going to do with all three is if a child bites, first thing you're going to do is you're going to remove the biter from the situation immediately. So you're going to pick them up and you're going to say, you're going to change your tone of voice. This is so important, parents and caregivers. You have to change your tone of voice and say in a lower tone of voice, do not bite. That hurts. We don't bite here, or something to that effect, but you change your tone of voice. Very firm, and you mean business. You take them and you separate the child. Next thing you're going to do, so if you have a crawler or a toddler that has no clue, I would put them in the high chair or in an exerciser for just a few seconds so you can go and take care of the child, the said victim that's been bitten, because you want to comfort them and you want to see where they bit them and if they broke the skin. You have to have time to do that. And not to mention parents, daycare providers have not just your child, but we have sometimes 16 other kids. Me personally, I've got 8 children total, so I've got to make sure that my little biter is secure and safe where they can't get anyone else yet, right? And then I have to make sure that my other kids are well taken care of and secure as well. So I'm going to comfort the victim and say it's okay, and and treat the bite if I have to, if there's anything to be treated, but I'm definitely going to say that hurt. And then I'm going to talk to my toddler, because I talk to my toddlers like they're little humans. And I'm going to talk to my toddler and be like, hey, look what you did. This hurts. I don't care if that baby's 10 months old or a year old or 18 months old. You talk to them like a human and say, hey, that hurt. Look, you're just crying. Why'd you do that? We don't do that. That is not nice. Okay? So that's what I do. And then I take the toddler out of the saucer or the pack and play or the high chair, and then I watch them because I need to see what kind of biter I have. So the happy biter is pretty easy because they have a sense of remorse. They tend to be super happy, happy-go-lucky. They just, oh, I'm so excited. If you tell them, that hurt, you can't do that. That is not nice to your friend. As soon as they go to try and like do the ox elk thing and, you know, that's the love thing, and then go to bite, you say, clap your hands, snap, no. And that usually stops them in their track. And they're like, oh, okay. And then you redirect the toddler. You redirect them immediately. You take them away from that situation. Even if they're not doing anything, you redirect them, because that's kind of, it's almost like a puppy. Puppies need to be redirected and not focus on this thing and go focus over here. So that's what I do with my happy-go-lucky and my impulsive biter, because they're both impulsive. The happy-go-lucky one will have a little bit more remorse, where my impulsive biter will be like, oh, I did that, whoops. That one's gonna take a little bit more work and a little bit more observation. So in order to determine what kind of biter you have, it's kind of easy. Well, I guess I can't say it's kind of easy. I've been doing this for 20 years, so it's easy to me. What you'll want to do is you want to observe when your child or the child in your center is biting and why. And then you can get a sense of, okay, this kid bites when he's pissed off. This kid bites because he's super excited and happy. And this kid bites because he just can't help himself and he just did it before he realized. So the top two, the happy and the impulsive biters, it's a phase. It's easy to redirect them, and the phase is over before you even know it, just depending on the personality of the child. Some of the children get it like this. Some of the children, it takes a little bit longer to redirect them, but consistency is the key. And you want to make sure, if you're a daycare provider or a parent, that you communicate with whoever. So if I'm a daycare provider, I'm going to communicate with the parent and say, hey, your little guy bit today, and this is why I think they bit. So if you tend to tackle and play rough with your toddler, say like a dad goes and they play wrestle and they do all these things, I'd be like, hey, lay off the wrestling, lay off the roughhousing at home until your toddler is done with this phase. Then it's okay. Because if you encourage the roughhousing at home, then they think it's okay in daycare. Does that make sense? And if they bite because they get so excited, wrestling and thing kind of, it ramps up the energy, and then they're like, you don't want that. With that, I would say that to the happy, impulsive, all three biters, I'd be like, okay, make sure you cut out the roughhousing at home. If you are a parent and you notice that your child is biting their siblings, make sure you tell me or your daycare provider and be like, hey, my toddler has been biting their older brother or sister or their sibling, and they broke the skin. And I'll be like, okay, I will be on the lookout. Now, what I want to do as well is to kind of not demonize these children that are biting, because it's a normal part of their development. It's our jobs as parents and daycare providers to fix it, but they're not bad kids. I hate the fact when I see on Facebook groups because I belong to daycare provider owners Facebook groups, I hate when I see a daycare provider get so upset with a child that bites and like wanting to terminate them. You know, there is a point in time, which is the frustrated biter, which I'll get to in a second, that you may have to have a come to Jesus moment with the parent, as far as, you know, saying, okay, this child is biting really hard and they've left bruises and they're doing it in a sneaky way. And that's mostly older children. It's not really, I have not seen a baby or a toddler be that frustrated biter, the one that sneaks around and like bites. And I'm telling you, when I tell you they sneak around, they sneak. They'll get close to a kid playing, pretending that they're playing, and then that is a more serious situation. And then I can understand a daycare provider getting upset and wanting to terminate this child. So most of the time, I just want to assure parents and daycare providers, both of you guys, that if your child is, or the child that you're caregiving is a biter and it's a happy or impulsive, this is a phase. It will pass. Yeah, it sucks that they bit another kid, but that other little kid will be okay. I promise. It's like they don't even think about it. You know, after it's done, it's done. It's like riding a bike. It's like learning how to walk. It's like crawling. It's like falling down. Just because they fall doesn't mean that they're not going to try it again. Or just because a toddler bit them doesn't mean that they're going to hate that toddler. They're going to forget about it because they're kids. That's the beauty of children. I love them so much because of that. I love them so much. They're so forgiving. They're so sweet. And I love that. So please don't demonize your child or the child in your daycare center. Now, what I did as far as parenting advice for siblings that are getting bit at home, this is the advice that I would give because my own granddaughter was a biter in my daycare when I had my bigger center. And she was the impulsive biter. And she was also a frustrated biter. And she was only 15 months old and she had a temper. She was sassy and had a temper. And I basically said to the older children in the daycare, I was like, do you see this little baby over here? And they're like, yes. And I'm like, and I don't know why I came up with baby wildcat. It may sound dumb, but this is what I said. I'm like, do you see her? She bites. She hits. She pinches. She's a baby wildcat. Now, what do baby wildcats do? They bite. I'm like, yeah. I'm like, do they scratch? Yeah. I'm like, exactly. I said, so baby wildcats don't understand why they bite. And they just do it. And then they get mad and they scratch and they bite. So what can we do to help this baby wildcat not bite? So then the toddlers are like, I'm like, don't take away her toys. Kind of give this baby wildcat their space. And I'm like, give them their space. And then I'll actually show them if she's playing somewhere. I'm like, you see? I'm like, this is the baby wildcat in their natural habitat. Now, she's got these toys, right? Uh-huh. I'm like, yeah. I'm like, are we going to go get those toys? No. Are we going to go up to the baby wildcat and like try and play with her? No. So I empower the older children to kind of stay away and keep their distance. Now, this little toddler, my granddaughter, doesn't care. She didn't care that I was saying that because she wants to play with her own toys. She's a 15-month-old baby. They are egocentric. What's theirs is theirs. And if they have a sassy personality, they will bite you. So the way, I don't know why I came up with that metaphor of the baby wildcat, but it seemed to work. And it worked until the phase was over. It really did. And I had 19 kids in my old center. 19. And I was able to get that phase done and over with. Thank the Lord, because that was stressful because number one was my own grandchild. Number two, my daughter, her mother was working and she was so upset because she's a mom and she's like, why is my kid horrible? You know, it's the way parents think. Am I a bad mom? Why does she act like this? You know, take a step back, people. It'll be okay. So that is my main trick as far as if your toddler is biting a sibling. Just kind of explain, empower that bigger kid to actually be in charge of their own body in that sense. And say, hey, if you do get bit, it's kind of on you. I told you. Especially if the kid's like 6 years old and they're antagonizing the 15-month-old and the 15-month-old goes after them and bites them. That way you've already given them the expectation. Let's see what else I have here. If you can't supervise a toddler, say like you're making lunch and you cannot watch the children behind you or beside you, and you've got your little biter who's in the midst of their phase of biting, what you're gonna do is, I've got like one of those gray gates that's kind of like a pen. You can put that and separate the child, but either way, you've got to separate the toddler from the other kids, especially if you can't keep your eye on them in the situation. And certain, say like you're getting art supplies down or you're changing diapers. I mean, there's so many situations where caregivers, we have to have our backs turned because we're doing a task, right? So if you know that this baby is a biter, what you're going to do is you're going to make sure that that baby is separated temporarily. I mean, still within the room. I don't put them in another room or anything. I have them penned out, have them in a saucer, I have them in the high chair eating snacks or something to that effect, to where I can go and safely change diapers. And it's really hard to remember this, daycare providers, because it's so easy to go from one routine to another, to another, to another, and then you're like, crap, forgot to separate the kid, and now the kid just bit someone, right? Just remember, first things first, until this phase is over, separate that little guy or girl that's doing the biting, and it will prevent a lot of heartache, trust me. And it's a hard habit to get into, but when you get into that habit, it makes your life a heck of a lot easier. And parents, always communicate with your daycare provider if your child is having an issue with biting, if you need advice. We've been there, we've done that, we've seen it, we know how to deal with it. And a lot of my tips and tricks, I've been taking a whole bunch of daycare continuing education classes from the University of UVU, Utah Valley University. So it had a thing on biting. There are some things that I don't agree with, only because the scope of ages of the kids is more like preschool ages versus babies and toddlers. I'm strictly talking about babies and toddlers between 15 months and 2 years old. All right, and that will do it. Like and subscribe to my channel if you like the content, and comment down below if there's any other tips and tricks that you want to hear from me. I also have a daily vlog channel. It's a playlist on this channel, the Natalie Catherine channel. I've got a vlog. I've started a vlogging journey and a 30-day no sugar challenge. So parents, we can always have a New Year's resolutions to improve ourselves, whether it's, if you make yourself better, you're a better parent. Daycare providers, if you improve upon yourself, you become a better daycare provider, right? So me, I want to cut out sugar for 30 days and see what happens. So I'm doing this vlogging playlist thing. So if you click on my channel and go to playlist, you'll see my vlogging journey there. And I've never vlogged before, and it is a learning experience. And the way that I'm learning how to vlog is by watching YouTube tutorials only. I have no clue what I'm doing, including here. That will wrap up everything. Like and subscribe, and Happy New Year, happy 2022. See you soon.